Hello everyone, I'm Mindy Johnson here. So I'm going to talk about an issue that I think is important for older adults that we need to address for the future, and then I'll talk about some of the questions that were provided for discussion. So the first issue that I think is important to address in the future for older adults is the long-term care situation here in the United States. I currently work at a skilled nursing facility in Chico, and I saw while working in admissions that there is a lack of long-term care for people, especially those that are not able to pay privately and are relying on Medi-Cal. With Medi-Cal's low reimbursement rates, it results in facilities' reluctance to accept very many Medi-Cal patients. This year I also interned in an acute setting, and I saw the challenges that discharge planners had when trying to place residents like with Medi-Cal into long-term care, and it's just challenging on both sides. And then I think that issue is further complicated by long-term care insurance that people provide. From my experience, both in the acute setting and in the skilled nursing facility, most places don't accept the long-term care insurance, the private ones that people pay into, and long-term care is very expensive in a facility. I know as of last year, for a month of long-term care in the skilled nursing, it was well over $6,000. So that's just not feasible for many families. And then also the lack of staff available in long-term care facilities. I did some research this semester for a paper, and it talked about the lack of direct care providers, such as like nursing and CNAs that are available. And I know that in the skilled nursing facility where I work, we've had that issue as well. And with the growing population of older adults, I can't imagine that it would improve at all. It's just going to be a greater and greater need. So I think that's one of the most important issues that we need to address for older adults in the future and for our community, because it affects older adults, the caregivers, the families, and it's a stressful situation for people to be in. So hopefully that changes. And then to talk about some of the questions, I liked the textbook for the class. I thought the information was easy to understand, and I got a lot out of it. So I have no complaints there. The assignments, I especially liked the Affordable Care Act information and the insurance readings, like the high cap and the Medicare readings that we did. The information wasn't really new, but it was good to have a refresher, and then also good to know exactly where I can access that information if I need to reference it in the future. And I liked the DME assignment, where we went on the website. I didn't know that there was a website available, and I was very unfamiliar with how many different modifications can be made for people who have had strokes or have different disabilities. So that was useful, and I think working as a medical social worker after I graduate, that'll be useful information to have. And who knows, maybe personally too, older family members, they might benefit from that. I know my grandmother has the enlarged utensils for eating to make it easier because she has a hard time gripping, so maybe I'll find something on there that would be beneficial to her too. The one thing with the assignments that I thought was challenging was a couple of them asked us to use like family members or friends' actual Medicare number, and I found that people were kind of reluctant to share their Medicare number with me because a lot of them, the Medicare number is the same as their Social Security, and my mother-in-law said that when she signed up for Medicare, the counselor actually instructed her not to share her Medicare number. So maybe if there was a way to do those assignments without that, or modifying them somehow so we wouldn't need that information. And then I was also wondering, with the Affordable Care Act, since there's so many changes and it's kind of a evolving thing, it seems like, I was wondering if the readings were up to date, because I found the information useful, but I wouldn't want to have old information. So, overall I liked the information and the topics that we discussed. I thought that this class had the most applicable information related to my internship into the field I'll be entering after graduation, so I've appreciated the topics and the content. A couple of the top things I learned, I kind of mentioned already. The DME and learning about those different things is useful. The Affordable Care Act information. the Older Americans Act, I had heard of the Older Americans Act before and done a small amount of research on there, but through readings in the book, and then I wrote my final paper on the Caregiver Resource Program, which is funded through the Older Americans Act. I really feel like I have a good understanding of the different organizations. How I was unclear about how the Area Agency on Aging fit into it, and the Department of Health, and all those different agencies that affect the services provided to older adults. And so now I feel like I understand the whole picture a little better. Yeah, so that was good to know. And then I also enjoyed, or I guess I should say I thought it was useful to do the advanced directive exercise. Last year I had started making an advanced directive for myself, but didn't finish, and I thought some of the readings related to the advanced directive, as far as different things to consider, and different wishes, I thought that was useful because I can reflect on those things, and I feel like I'd be able to make it an advanced directive that was more reflective of my actual wishes. And also I'm going to have my husband do it this summer, I hope, so he can read over those things and then make one for himself too. So I thought those assignments were great and really benefited from them. As far as recruiting more students to gerontology, I think that it would be useful to start earlier. Some of the different research I've done showed that when younger people are around older adults and interacting with them more, it reduces ageism, and I think reducing that ageism would increase the people that were interested and willing to go into gerontology. Excuse me. So maybe starting, at middle school and high school levels, volunteering activities. I know they have, I can't remember the exact name of it, but they have an organization that tries to connect the younger and older populations. And so I think supporting that movement and those ideas would be beneficial in eventually seeing people enter into the field of gerontology. Also just doing education. I know for our grant writing class we did some research about outreach to college students to increase their their information and awareness that gerontology exists, how it can be applied to different fields, whether it's an architecture major who is building wider doors for people who have wheelchairs, an engineer creating and designing more useful wheelchairs, and whatever it may be. So doing outreach can help with just educating the general population that it's an option and it's available and there's a need. And a couple of things that I think that our community would benefit from would be transportation. Always seems to be an issue when talking with people that are working with older adults in different settings, whether that's in the home, skilled nursing facilities, home health and hospice. So figuring out some way to, I know it's a complicated issue, but figuring out some way to make transportation more available for older adults, especially those living at home. And then also creating more caregiver services for older adults, like respite care and counseling for caregivers. I know that the funding has been cut for a lot of these services, and they're needed, and I hear caregivers saying and expressing how much they're struggling on a regular basis. So I think it would be really great if we could support the people that are caring for our older adults, and it's a cost-saving measure for the government as well. So it benefits everyone. So those are my thoughts. Thanks, everyone. It was a great semester. I learned a lot, and I appreciate all of your guys' input, and I hope you enjoy graduation for those of you who are graduating. Take care.